I'm here today to discuss a prevalent healthcare issue affecting our community and my daily healthcare practice. I know that you have been an activist and strong voice in our legislature for healthcare reform, specifically mental health care reform, and that is precisely the issue that I'm here to discuss with you. It has recently been reported that 1 in 4 Americans at some point in their life suffer from mental health disorders, and mental health disorders account for more disabilities than any other illness. Illinois communities have witnessed this pandemic firsthand. Our communities have been negatively affected over the last decade by massive funding cuts, which have left minimal facilities available to provide treatment and support this disease. With healthcare expenditure reform ongoing in our country and millions of Americans still without insurance, the need for public health services is growing apparent. Illinoisans need to be proactive in order to fight this battle. When resources allocated to manage mental health are redirected, the result is poor standards of care and an influx of patients at our acute healthcare facilities and hospitals. Critical care nurses and first responders have seen this increased need for crisis management and the detrimental outcome relating to lack of access to outpatient services. Multiple state-run facility closures have created geographical barriers to in-need individuals seeking access to mental health services. This results in individuals choosing to try and cope on their own. I personally understand how important it is to manage mental health and the negative repercussions poor management can have. I have held the hand of a young mother after she was extubated for attempting to hang herself. She expressed that when she chose to buy groceries instead of fill her prescriptions and couldn't cope anymore, she chose her own solution to her problem. I'm here to propose a different solution to this community issue. Mobile Crisis Teams, or MCTs, are on-demand, 24/7 mobile health services composed of healthcare and public safety professionals trained to respond to mental health crises. These teams will help bridge the large geographical gap in access to community mental health services. Research supports this approach, as this intervention is successfully used in acute care settings for de-escalation and symptom management. Therefore, our community implementation is a viable option. I will provide important data and positive outcomes of inpatient scenarios where this tactic has been successful. I look forward to working with you and your committee to advocate for the 1/4 of our community battling with healthcare needs. I will make myself available and work diligently to provide sufficient evidence that access to mental health services in Illinois is an imminent health concern, and this action is our best course of treatment. Mobile health teams are the first step in this reform. Thank you for your time.